Chronic osteomyelitis is an infection of the bone and bone marrow which is persisting for a duration more than 2 months. So formation of sequestrum is a pathognomic of chronic osteomyelitis. Coming to the clinical feature, symptoms include pain, sinus, which is an opening present in the skin. Then there can be discharge of bony pieces through the sinus, which is a pathognomic symptom. Signs include on the skin there can be multiple scars, and the skin will be so thickened and rough, and the skin will be adherent to the underlying bone. And you can also see a sinus, which is a clinical hallmark. Coming to the management, investigations include blood tests where you have to do total count, differential count, ESR, CRP, which all will be elevated. Neutrophilic infiltration, neutrophilic leukocytosis indicate that it is a bacterial infection. So X-ray will show the following findings. It can show a cloaca, which is an opening in the involucrum, a sequestrum that's a dead bone, involucrum, which is a newly formed bone around the sequestrum, and can also show an abscess cavity. Other investigations include MRI, and if there is pus, you can send it for culture and sensitivity. And after that, you will be giving antibiotics. So treatment, it includes both the surgery and antibiotics. What is the surgery which is done? It is sequestrectomy and saucerization. So steps of surgery. First you have to drain the pus and send it for culture and sensitivity. Now you have to excise the sinus and sinus tract, and you have to remove the sequestrum or the dead bone. And then you have to curate the walls of this cavity till paprika sign is seen. So what is paprika sign? It is a tiny bleeding spots which are seen on the bone, and that indicates the viability of the bone. So if that sign is seen, it means that the bone is viable underneath, and you have to stop curettage. And then you have to saucerize this cavity to help drainage. So like this shape is converted to a wide opened mouth so that the drainage of the pus is possible. So after that comes the antibiotics. You have to start with a broad spectrum antibiotic, usually amoxicillin for 2 to 3 days till the result of culture and sensitivity comes, and after this you can change to appropriate antibiotics for better results. Duration, the total duration of treatment is 6 weeks, and out of that the first 2 weeks you will give IV antibiotics, which will be followed by oral antibiotics for 4 weeks. Now complications, there can be acute exacerbations, that is acute on chronic osteomyelitis can occur. So the bone becomes very weak, so the pathological fractures can occur, non-unions, and there will be the difficulty in treatment of this infection. There can be malignant change of this long-standing sinus into squamous cell carcinoma, and there's also a risk for amyloidosis.